public option. There are 1,300 insurance companies. Let them all compete for our dollar. You'll see the price come down. No more pre-existing condition clauses. If you're chronically ill, you have the right to buy health insurance. What is that? It's a gutsy politician passing a law. No cost to the taxpayer. Who will bear the cost of this? Probably the lawyers and the health insurance industry, not the taxpayer. We don't have any money left. We're already deficit spending. Most important out of all these options, and there are other options on the table too, which should be debated. They should be debated, not rushed through. Most important, I think, is tort reform. Reduce premiums. Encourage doctors to go into high-risk fields. We're losing obstetricians. We're losing neurosurgeons. We're losing invasive cardiologists. That hurts the people. That's because they can't afford the premiums to go into those high-risk fields. I teach medical students. They don't want to go into the high-risk fields because it's too expensive for the malpractice premiums. But that's not the worst thing. The worst thing is defensive medicine. My generation of doctors practices in every office, in every hospital, in every clinic. There is an excessive use of procedures and testing, not for the benefit of the patient, but to protect the doctors and the hospitals from the lawyers. If you have tort reform, where it's not a lottery for the lawyers to make $1 million, if you have tort reform, doctors will end up not ordering so many tests. That's where the cost of health care is. If the administration was serious about controlling the cost of health care, they would put tort reform back on the table. The fact that they won't even discuss it tells me they're not serious about controlling the cost of health care. What they want to do is control health care. Now, who do you trust? Do you trust the regular folks, the doctors in your community, to make decisions on your health care? Or do you trust the politicians in Washington who want to control health care? I say trust the doctors, nurses, and hospitals to make proper decisions for our communities. When a doctor decides what benefits and what procedures and what surgery you deserve, he discusses it with the patient, he discusses it with the patient's family, and he takes the standard of care in the community into consideration, and he takes what's best for the patient and the patient's family into consideration. Politicians in Washington will have none of that. They don't even know you. They will base their rationing decisions on age and cost. My practice of geriatric medicine would be at risk because my patients would be at risk. So I'll say again, who do you trust? The doctors or the politicians? I say let's keep debating. There's no rush. Let's talk about this. Keep showing up at the town halls. Keep showing up at the rallies. Come to to Washington on September 12th. Make a stand. Keep going to the tea parties. It is our duty as Americans to speak out, and believe me, future generations will thank us. Thank you.